AAPC CPC Model Paper 1, Chapter number 12. In these chapters, we will be tested on 60,000 code series of CPT section is involved surgical procedures performed in the nervous system and will include the codes pertaining to the skull, meninges, brain, spine, spinal cord, extracranial nerves, peripheral nerves, and the autonomic nervous system. This section will consist of 6 questions. Question number 1. A physician performed craniotomy on a patient with a severe head trauma and intracerebral hematoma. Due to the patient's condition, the procedure was extremely difficult, requiring a significant amount of extra time and effort. What is the correct code for this procedure? So there are 61,000 codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is the craniotomy procedure done in a patient with a severe head trauma and intracerebral hematoma. The procedure required a significant amount of extra time and effort. When you see the answer, only 2 codes are there, 61,315 and 313 with additional modifiers. So you can use the elimination method to find the answer. So directly go to the codes. So when you directly go to the code, you can see 61,313, that is intracerebral. So this is the continuation of the previous code. The previous code says craniectomy or craniotomy exploratory intracerebral. So here this also intracerebral. So the correct code is 61,313. If you see other code 61,315, that is intracerebral. But in our case, this is intracerebral. So the correct code is 61,313. But that code only is not enough because there was another case here. You can see the procedure required a significant amount of extra time and effort. So if any procedure needed extra time, you have to put the modifier. So when you go to the modifier of the first cover page of the CPT code, there you can see modifier 22, that is increased procedural services. 23 is unusual anesthesia. But in this case, the 22, that is increased procedural services, is the correct modifier. So the code 313 with correct modifier 22. So the correct answer is C. So if you encounter this case in a real working scenario, you have to find the answer using the CPT alphabetic index. So when you go to the CPT alphabetic index, there you have to go to the craniotomy. In the craniotomy, you have to go to the subcategory of evacuation of hematoma. Then it will lead you to the following code series, 61,312 to 315. Again, you have to go back to the tabular list and confirm the answer. Once you confirm the answer, you also have to go to the cover page of the CPT. There you have to find the modifier. So this correct modifier is 22. So the correct answer is C. Question number 2. A 40-year-old male has lumbar facet syndrome. Under fluoroscopic guidance, the affected nerve in the facet joints of the lumbar region is destroyed by a neurolytic agent in the right segmental medial branches innervating facet joints L3 to L4 and L4 to L5. What CPT codes are reported? So here you can see there are 64,000 code series are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case you have to highlight this is the lumbar facet syndrome and the procedure done using the fluoroscopic guidance in the affected nerve. So they are destroyed by neurolytic agent, the right segmental medial branches from L3 to L4 and L4 to L5. So when you see the answer, the nearby codes are used. So you can use the elimination method to find the answer. When you go to the code 64,493, that says injection, diagnostic or therapeutic agent. But in our case, this is not injection, it is destruction. So you can eliminate the answer A. When you see other codes 64,633, destruction by neurologic agent, paravertebral facet joint nerves with imaging guidance, fluoroscopy or CT, cervical, thoracic, single facet joint. Here it says cervical or thoracic, but in our case it is lumbar. So 634 is cervical or thoracic with additional facet. If you see other code 64,635, that is lumbar or sacral single facet joint. plus 64,636 is lumbar or sacral is additional joint of facet. So here we have used two joints. So first one you can use the code 64,635. For the second one you can use the additional code 64,636. So 35 and 36, the correct answer is B. If you encounter this question in a real working scenario, you have to use the alphabetic index of the CPT codebook. So when you go to the CPT alphabetic index, here the procedure is the destruction. So you have to go to the destruction. There it will go to the nerve. When you go there, it will see nerves destruction. Again, go back to the nerves and go to the destruction. The subcategory says paravertebral facet joint. In this case, it will lead you to the code series of 64,633 to 36. Again, go back to the tabular list and confirm the answer. In this case, the modifier 51 is never appended to an add-on code. So we have used the add-on code here, that is 64,636. So there's no need for any modifiers. So the correct answer is B. Question number 3. A pediatrician performed a lumbar puncture on a 2-day-old premature infant weighing 2.3 kg with possible meningitis. What is the correct code for this service? So you can see the adjacent codes are available 62,272 and 70 with the modifiers. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you had to highlight this is the lumbar puncture done in a premature infant weighing 2.3 kilogram. Okay, when you go to the codes, 62,270 is spinal puncture lumbar diagnostic. 62,072 is spinal puncture therapeutic for drainage of cerebrospinal fluid by needle or catheter. But in here, it is used for the possible diagnosis of meningitis. So the correct code should be 62,270, spinal puncture lumbar diagnostic. But keep in mind, any infant less than 4 kilogram, you have to use the modifier. So here you can see the modifier 63 is used for procedure performed on an infant less than 4 kilogram. So the correct answer is not B, it's C. 62,270 with the modifier 63. So if you encounter this case in a real working scenario, you have to go with the CPT index. So in the CPT alphabetic index, you have to go to the lumbar puncture. There you have to go to the subcategory of diagnostic. It will lead you to the following two codes, 62,270 and 62,328. Again, go back to the tabular list and confirm the answer. Also, you have to use the modifier 63, that is procedure performed on infants less than 4 kilograms. So the correct answer is C. Question number 4. A 63-year-old female patient diagnosed with papillary carcinoma of the thyroid admitted for a total thyroidectomy. The neck and anterior chest are prepped and limited neck dissection is done on the thyroid side, dividing the isthmus on the right lobe side of the midline, removing the left lobe and several enlarged lymph nodes. Then dissection is performed on the right side, removing the right lobe from the trachea. Which CPT code is reported? So here you can see 60,000 series codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is the patient with papillary carcinoma of the thyroid. Here, total thyroidectomy is done with the limited neck dissection. Removing the left lobe and several enlarged lymph nodes, also the right lobe from the trachea. So you can see the adjacent codes are available. So you can use the elimination method to find the answer. So if you see the code 62,220, that is total thyroid lobectomy, unilateral with or without splenectomy. 240 is thyroidectomy, total or complete. 252 is thyroidectomy, total or subtotal of malignancy with limited neck dissection. So this code is exactly matching the scenario. The thyroidectomy, total or subtotal for malignancy. Here the malignant patient undergone total thyroidectomy with the limited neck dissection. So the correct answer is C. Okay, if you encounter this case in a real working scenario, you have to go with the CPT alphabetics index. So when you go to the index, there you have to go to the thyroidectomy, the subcategory total, then the subcategory for malignancy, then subcategory limited neck dissection. It will give the code 60,252. Go back to the tabular list and confirm the answer. So answer will be C. Question number 5. A physician sutured 3 digital nerves in the left hand, the command sensory nerve in the left foot, and 2 command sensory nerves in the right foot. What codes need to be reported? So there are 64,000 codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight the following things. There are suturing of 3 digital nerves on the left hand, command sensory nerve on the left foot, and 2 command sensory nerves on the right foot. So you can find the answer using elimination method. Here you can see all 4 are to have 831 code and 832 like adjacent codes are available, so you can use the elimination method. So when you go to the 64,831, that is suture of digital nerve, hand or foot, one nerve. So here you can see 3 digital nerves in the left hand suture. So this code should be there. So 64,831, that is for only one nerve. 832 is each additional digital nerve list separately in addition to the code for the primary code. So first nerve is 64,831, second nerve is 64,832. There's third nerve also, so you have to multiply by 2. So 64,831 and 64,832 into 2. So that is for 3 digital nerves of the left hand. When you go to the other code, 64,834, that is suture of one nerve, hand or foot, command sensory nerve. You can see command sensory nerve in the left foot, that is one nerve. So you can use once this code. So 64,834 and also 64,837, suture of each additional nerve, hand or foot. So you can see the command sensory nerve of one command sensory nerve in the left foot and also 2 command sensory nerves on the right foot. So you have to use this additional code multiply by 2. So the correct answer will be A. First code, the additional 2 nerves multiply by 2, and the second code and the additional 2 nerves multiply by 2. So correct answer is A. If you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. When you go to the CPT alphabetic index, this procedure is suture. So go to the index of suture and go to the subcategory nerve. Now it will lead you to the code series of 64,831 to 876. Again, go back to the tabular list and confirm the answer. Once you confirm the answer will be A. The final question of 60,000 series codes. A 53-year-old woman has been having significant sciatica. She is going to have a neuroplasty of sciatic nerve. What is the correct code for this procedure? So you can see 64,000 adjacent code 702, 4, 8 and 12. So please pause the video, take your CPT code book and find the answer. This is a straightforward one. Okay, in this case we have to highlight this is the sciatica and neuroplasty of the sciatic nerve is done. So when you check the codes, 64,702 is neuroplasty digital one or both or same digit. 704 is nerve of the hand or foot. 708 is neuroplasty major peripheral nerve, arm or leg open other than specified. 712 is sciatic nerve. So this is the continuation of previous code. So neuroplasty, sciatic nerve. So the correct answer is D, 64,712. If you encounter this case in a real working scenario, you have to go with the CPT index. So in the index, first you have to go to the main procedure, that is neuroplasty, then go to the subcategory of peripheral nerve, then go to sciatica. So it will lead you to the code 64,712. So the correct answer is D. So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.